Hello there. I'm Zila Langshan. I'm the founder of HiQuity Solutions. We are reviewing, from a strategic breakdown perspective, a federal funding opportunity released by SAMHSA in a pack of 3 last Friday at the end of the business day. This is the Children's Mental Health Initiative funding opportunity. And if we want to try and sum up the entire thing to sort of position this as you consider make this decision going forward, this is a large-scale SAMHSA systems of care cooperative agreement opportunity for applicants who are ready to launch coordinated children's behavioral health infrastructure. This is children, youth, and young adults with serious emotional disturbance under active federal oversight and a meaningful non-federal match requirement. There's the universe. Let's do some breakdown. Looking at the financial scale of this opportunity, this is a large one. SAMHSA has set aside $43.35 million in total anticipated funding, expecting to make up to 22 awards. The annual funding limits will vary by entity type. States and territories can request up to $3 million per year, and then political subdivisions, tribes, and tribal organizations can request up to $1 million per year. At least 3 of these awards are specifically reserved for tribes or tribal organizations assuming sufficient application volume. We hope that that is met. The project spans up to 4 years. Applications are due April 20th at nearly midnight. You have approximately 5 weeks to engage. In this funding instance, eligibility is going to favor states and territories, governmental units within political subdivisions, and then also Indian tribes or tribal organizations. For state applications, the structure can be considered broader. It requires them to identify at least 2 local jurisdictions within the state where activities will be implemented. There are some important disqualifiers to keep in mind. Recipients funded under the similar opportunity in year 2023 or fiscal year 2024 are ineligible. Prior CMHI, prior Children's Mental Health Initiative recipients cannot reuse jurisdictions that they already served in an earlier project. It is crucial to understand that this is a large-scale systems building opportunity. This is not a narrow opportunity. This is not a standalone direct service grant. SAMHSA will expect applicants to establish or strengthen a community-based system of care, requiring formal cross-system partnerships, a single point of access, coordinated care delivery, and ensuring all required behavioral health services are available across the selected communities. The operational expectations here are heavy and broad. Your system of care must ensure the availability of diagnostic services, outpatient care, 24/7 crisis services, intensive home-based services, day treatment, respite care, therapeutic residential options, and individualized service plans. Notably, you are expected to launch and begin direct service delivery within 9 months of receipt of award. The qualification process is going to heavily favor execution-ready applicants. Any loose coalition language, not competitive. Reviewers are looking for real operating agreements and partner accountability. A critical component, by the way, this is new, of your readiness proof will be your attachment 4. It's a 2-page maximum project timeline that is now explicitly scored. So the quality and realism of your sequencing are part of your core competitiveness, no longer a compliance checklist. This scoring architecture tells us exactly where competitive separation will occur. Section B, proposed implementation approach, carries the highest weight at 30%, 30 points, followed closely by Section C, your proposed evidence-based practices, early intervention, etc., community development, 25 points. Add that to Section D, organizational experience and staffing at 20 points, and these 3 sections alone carry 75% of your total score. Reviewers are going to be weighing your implementation design. They're going to be looking at your practice selection, your fidelity, your partner structure, and staffing readiness far more heavily than your community needs statement alone, which is worth 10 points. This is readiness sensitive, so pressure inducing in some cases. SAMHSA is imposing an incredibly compressed build-out timeline that requires early execution. Within 3 months of award, you need to have a governance board established with cross-system representation. At 6 months, formal cross-system agreements need to be executed. At 9 months, a successful operation of a single point of access, an outreach screening and referral system, individualized service planning processes, and the full launch of your required services. Knowing that this is a cooperative agreement, anticipate active federal programmatic oversight, including quarterly SPARS reporting. Staffing expectations are highly prescriptive. Your project director needs to commit to a minimum of 75% level of effort. The lead family coordinator, also a minimum of 75% level of effort. This is valuable. They need to also uniquely possess lived experience as a primary caregiver of a child or youth with serious emotional disturbance. Finally, the evaluator must be a different individual from the project director and maintain a minimum 25% FTE. To position yourself for this funding as a win, demonstrate immediate operational readiness. A major competitive and sustainability threshold is living inside of the strict match requirement. Applicants will need to secure non-federal funds of at least $1 for every $3 of federal funds in years 1 to 3. And then it'll steeply escalate to a 1-to-1 match in year 4. The most competitive proposals will come from applicants who already have this cross-system partnership in play, a viable match strategy, clear service network architecture, and near final leadership staffing in place at the time of submission. As a decision maker, your top of line is operational readiness. Where do you stand? They'll want to finalize your system, assess your full partner fit, secure your match, and then demonstrate that you are execution ready. If you'd like support on the way, let us know. You can find us online for a vetting call, a strategy discussion at www.HiQuitysolutions.com. HiQuity is HiQuity solutions.com. Till then, keep well, take care of yourself, and here's to lift off.